Sorry for that. So, before we begin the topic, a very important part, I think so, which Dr. Bansal also pointed out, is to prepare yourself as a parent. Because if you are going to get into difficult conversations with your child and you do not have a line of communication or a rapport with your child, a lot of what we are going to be talking about, you will not even be able to break the ice. So it's very, very important as a message that not only should a child be prepared for adolescence, the parent has to be prepared for adolescent parenting. Moving on, it affects all ages, and early recognition is very vital, and we will try and give you some red flags which will help you in understanding when the child is in need. So, when does stress become a problem? Now, most of us are going to be going through life with our share of stresses. And not all stress is bad. I remember my class 10 examination when my class teacher and the principal had come in and asked us, "Beta, are you nervous?" So some tried to say, "No, not at all, sir." Some tried to say, "Very." Some tried to say, "Yes, sir, we are." So that concept of optimum stress, that nervous energy, anyone who is a performer should know that we all need an optimum amount of nervous energy and focus to perform well. But if that stress is going to overwhelm me, if it is going to determine thoughts, kya hoga if I don't succeed, kya hoga if I cannot do this, if that becomes the predominant thought, then it becomes a red flag because it is overwhelming and it is interfering with my performance as well as my daily functioning. So we can divide these red flags into emotional red flags, behavioral red flags, and physical red flags. So suddenly the little one whom I have seen grown up right from childhood is sad, is irritable. Suddenly things that he would love to do, going out into the garden, calling his friend over, he suddenly loses interest in that, suddenly starts feeling that mera kuch nahi hone wala hai. A sense of hopelessness overcomes the person, or the person has excessive guilt, shame, worry, fear, a numbness within himself, and suddenly becomes detached from the family and the friends to whom he was so close. All of this can be a red flag. And the one red flag which should go out loud and clear is if you detect any sign of suicidal ideation, it is a red flag which you need to act on, not keep to yourself and refer to a psychiatrist. So that is the loud message which needs to go out. Behavioral red flags, you will find a lot of overlap between the symptoms, but by and large, anything which shows that the person who was an integral part of a family or a society has suddenly become withdrawn. You would find his academic grades coming down. A child who would sleep well, wake up at the normal times, suddenly has sleepless nights or is sleeping at odd times of the day, is not very worried about his appearance, is going on a path of aggression, risk-taking and self-destructive behaviors, and what is most worrying, and we've had entire sessions at this conference on substance use. That is what is worrying for all of us. I think so, as we've grown up, we've seen the age limit getting lowered. What was once a college problem has now started becoming even a school problem. They have difficulty concentrating. They suddenly start having obsessive thoughts and rituals, and some of them may progress into even delusional thoughts. They start hallucinating about and having delusions of persecution. So anything that comes in to this spectrum in the behavior or the thought process of this child is something which should be worrying us. Any changes in sleep patterns, and as we know, the person has become metabolically inert. He's suddenly gaining weight. His appetite is either voracious or he's refusing food. Either of the two extremes should ring a bell. And somatization. So for us pediatricians, what was once a worm infestation or a stomach infection suddenly becomes a sign, a red flag of mental health if the child comes to you and persistently complains of pain abdomen. In our culture, in India, children are very much judged. They are judged by what they are doing academically. They get very influenced by the family. Now, the family as a structure is under a lot of stress. We are introspecting where our culture had held our family together. But the modern fissiparous tendencies, which are tending to break up families, is also affecting the child. Failure is seen as a stigma, and screen time. We had an entire workshop yesterday on screen time. It is seen as a scourge, it is seen as a distraction. We need to make a balance and make it a digital attraction to be used productively. So, when to seek professional help? Most of these that we have discussed, we have seen and learned through maybe our own children. But did we know when to seek professional help? So, a rough estimate is if the symptoms persist for more than 2 weeks, that is something which should be worrying you. If you find that the child suddenly wants to miss school, doesn't want to go and play with his friends, doesn't want to have his meals at time, is sleeping or sleeping late into the night or oversleeping, or if he has suicidal thoughts, and the most important, with the breakup of the family structure, if we find that the child with both working parents is spending a lot of his time all alone, these are places where we must seek professional help. So this is just a chart which some of you can take, that if there is a withdrawal from friends, neglect of hygiene or grooming, even talking about death casually, major sleep or appetite changes, dropping grades, or any risk-taking behavior, all of it suggests that there should be parental action seeking professional help. So you have various kinds of frameworks. There is a framework known as the BASE framework, wherein the behavior, the appearance, the emotions of the child, and the situations into which the child is placing himself should appeal to the parent as an assessment. Now, we have spent some time discussing what are the red flags, but you have to initiate a conversation. You cannot suddenly say that, look, beta, there's something wrong, I have to take you to the doctor. It is going to immediately invite a negative response from the child, probably even hurt the self-worth of the child. So please try and start a non-judgmental conversation. I've noticed you are more down lately. How are you feeling? Or don't try to minimize the problem, that this is just a phase, it will pass away. Instead, say that this looks like being really hard on you. Let's talk about it. Then, try and speak to the child when he's not under pressure. You have sat down with the child and you have told the child, I'm going to be teaching you. Your grades are falling. it's a high pressure situation. Try and change that conversation to when you are having a walk or when you are in a car ride, and try and initiate some small conversations over there. And as a parent, we mustn't forget parenting is no more a monologue. It is a dialogue in adolescence. So our tone has to lower. It has to be an open and calm talk. And let's acknowledge their struggle. They are struggling with a limbic system which doesn't have the control of the prefrontal cortex. So it is hard for them. Let us acknowledge that and tell them that we've gone through the same thing. So what are the golden rules of parental conversation? Make sure that you sound genuine and you say what you see. Show that you care. You might be highlighting a problem, but please make your body language more than your spoken language such that the child can realize my ma or my baba is with me. Next is hear them out. Often in a parental role, we are giving advices. That's what we've done all through our lives, telling them when to wake up, when to go to sleep, when to study, when to sleep. It's not going to be that. We have to hear them out. Listen to them. Listening patiently is half the job done. Know your role, because while you are trying to be friendly and understanding, they shouldn't get the liberty that my parent is a permissive parent. They will allow me to do whatever I want to do. So those limits have to be set by the parent. And if, as a parent, let's all remember, when we bring up our children, it's not the experience of 10 previous children which is guiding me. This is my first time too. So seek help. Help from your relatives who have brought up children. Help from professionals who know and are trained in the art of speaking to children. So recognizing red flags is crucial. It is crucial because we need to recognize things early so that the intervention comes early. All of us who practice adolescent health do know that mental health issues that originate in adolescence, a majority of them, they can be put in place if they are tackled early. You let it linger and persist into adulthood, they are likely to be there with you for the rest of their lives and give you some pretty costly results. So let's promote this awareness together. Let's make it a stigma-free environment for the child, that if you have an issue, we are here with you as an equal partner who will motivate you to take the corrective actions. Thank you for your very patient hearing, and hope